First thing that we're going to show you is active, passive and resistive movements for the hip. What you will do is you will demonstrate and then ask the client to repeat what you just demonstrated for each of the actions of the hip. There's 6 actions. There's the flexion, extension, abduction, adduction, medial rotation and lateral rotation. The first thing you're going to ask them to do is flexion. Flexion of the hip is that. So demonstrate to them, make sure that they've got something to rest their hand on to keep their balance, and ask them to flex their hip. Ask them to do their good leg first and then their bad leg and compare the two. The next one is extension, so ask them to face whatever it is they're leaning on. Again, doing good and then bad, ask them to extend their hip. The important thing here is that they don't do that they actually keep their body upright and then go back. So they do extension of the good leg and then extension of the bad leg. The next one is adduction, so ask them to go this way again, and this time what they're doing is they're taking the leg across the body, good, followed by the bad. Abduction, you're probably better having them facing the couch again, because what they're going to do is they're going to take the leg out for the good, out for the bad, and again make sure they don't start bending the body, that the body's straight, and they just take the hip out. It's the hip angle that you're looking at. And the final two is medial and lateral rotation, so keeping them facing the couch, knees together. For medial rotation, what you're going to do is you're going to take the foot out, so it's the opposite from what you think. So it's the foot out for medial rotation, so I'll just do that on the other leg so you can see that. So the foot goes out for medial rotation, and for lateral rotation the foot comes in. So that's the 2 legs, and again compare good with bad, do the good first and then the bad leg. So that's active assessment for the hip. We'll now do passive assessment. So for passive assessment, what you do is you get the patient relying on their side. And the first thing we're going to do is we're going to do flexion. So cup their leg in their arm like this. Make sure that the body is completely upright in respect of the back here, so they're not leaning forward or leaning back. Support behind their back here, and what you're going to do is you're going to take the hip all the way up, ask them to move their arm out of the way so that you can get it as far as possible, and what you're going to see is how far does that go up. What does it feel like in the end point? Does it feel spongy? Does it feel bony? So what's the range of movement, but also what's it feel like at that end field, because that's what we're testing at the passive. So that's flexion. Keeping that hold, then take it straight into extension. So here, put your hand here to support them. And again, what does that feel like? Does it feel bony? Does it feel spongy? What's the range of movement? Keep the hold still, and we can take them into abduction. Again, what does it feel like? How far does it go? And we then let the leg drop fully into adduction. So that's 4 of your movements. You then ask them to go onto their front. And what we're going to do, and of course what we're going to do is compare good with bad again, but this is all one side that I'm doing at the moment. So what we will do is you'll test medial and lateral rotation. So there's your lateral rotation with the leg fully across the body, and there's your medial rotation. And again, you're feeling in that hip. So you're feeling with your hand, and you're also feeling with the hand that's doing the movement. What does that feel like? And what does it feel like here to your other hand that's on the hip? So that's your medial rotation there. And then you do that fully with the other side to test the good with the bad. So that's passive for the hip. The next one is resisted. So if we get them onto the side again, and we're going to do the same movements, but it's going to be with just doing resisted movement. Now resisted, what we do is we do it at midpoint. So if you think where the midpoint is between flexion and extension, there was full flexion, there was full extension, so the midpoint is somewhere around about there. So again, making sure that the body's upright, put your arm here for resistive flexion, so they're taking it to the midpoint, and what they're going to do is they're going to push their leg into your arm. So if you just now push your leg into my arm here, and you compare that with the strength of the bad side. For extension, midpoint should be exactly the same place. If it's midpoint between flexion and extension, it won't move. So we now take them, we just ask them to take that bottom leg out of the way forward slightly. That's it, so that we're in the same midpoint. And now push back into my arm. That's resisted extension. Now we want midpoint for abduction, which will be somewhere about there, and we ask them to push up into us. And again, you shouldn't be moving between abduction and adduction for the midpoint, so you get them to push down into us. Good. And now resisted medial and lateral rotation. So again, if we ask them to go in the front. So again, we want the midpoint. There was the extent of Myra's lateral rotation. There was the extent of her medial rotation. So midpoint somewhere around about there. So for resisted lateral rotation, they're going to pull this leg in. So pulling it across. And for resisted medial rotation, again, the leg shouldn't be moving because you've got it at the midpoint. Push out. And that is active, passive and resisted for the hip. Turn it off.